this bright Friday morning here in Monroeville. Well, this is a special edition of the Brush Morning Talk, and this morning we play host to Dr. Duba Crazian. Of course, he's an infectious disease expert. He's going to talk to us about the. He's going to analyze the third COVID-19 wave, including COVID-19 virus and vaccines, vaccine shortages, politicians, and COVID-19 pandemic, the wine economic crimes court, and we're going to finally talk about the pandemic health regulations. So there are lots of things this morning seated on your breakfast table to keep you abreast with the latest concerning the fight against COVID-19 and other related issues as well. So it is a very bright Friday morning. Of course, today is the ninth day in the month of July. The year remains 2021. And this morning, like we said, it is a very special edition of the Breakfast Morning Magazine program. And this morning we have infectious disease scientist, Dr. Duba Crazier. He's going to share his expertise with us this morning on the Brush Morning Talk. So we're urging you to keep tuned and we're urging you to be right there. Don't go, because together we'll give you the very best FM receiver has to offer you. And so this morning, what best you can do, those are we bring you a very splendid presentation of the Brush Morning Talk. And so let's go for a break. As we return, we have our guest, and our guest is nowhere else but Dr. Duba Christian. He's infectious disease scientist. He's going to share his expertise with us amid COVID-19. Let's go for this break and be right back. We did nothing, nothing that we owe you. We need something. Will you leave us alone? We have reason. Freedom is our goal. 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 I am surrender, falling on my people, fire in the gun. Oh, welcome back, Liberians. Welcome back to the Brush Morning Talk right here on Brush FM 94.7 megahertz, SEM TV and Brush TV, respectively. It is a Friday, of course, the ninth day in the month of July 2021. And so this morning, we'd like to welcome you back to the presentation. We urge you to keep tuned and keep inviting more listeners this morning. Together, we aspire the platform. Amid COVID-19, we have Dr. Duba Crazian. Of course, he's an infectious disease scientist. And many of you have heard of Dr. Young. He's one of Liberia's scientists, and he's been engaged with the issue of disease control and prevention. And so this morning, Dr. Young going to give his expertise on lots of current issues ranging from the fight against COVID-19. Specifically to discuss in detail the variant of the pandemic and several other issues this morning. We're going to talk about COVID-19, the vaccine shortages, politicians and their responses to COVID-19 as well. And then we talk about the War and Economic Crimes Code, and we conclude with the pandemic health regulations. And so it's a pleasure this morning. We go strictly to join our guest, but before that, let me join my colleague Frank. How are you this morning?
Thank God and for giving one another brand new day this morning to share some issues with the Liberian people and then discuss some critical national issues. I think it's another opportunity this morning for us to have Dr. Dubert Christian to express his personal, professional opinions on issues as it relates to the COVID-19 pandemic and also the world and economic code. I think it's a pleasure this morning for us to highlight some of these issues this morning.
Indeed, it is the Brush Morning Talk on Brush FM 94.7 megahertz, Brush TV Live, and SEM TV, respectively. Let's continue to share the platform this morning. So we go over strictly to our guest, Dr. Duper Christian. And this morning, like we told you, there are lots of key issues we're going to be talking about. And Dr. Young, I would like to say good morning. Thank you for joining us. And how are you today?
Good morning. I am very concerned about the situation in the country regarding the current wave of the COVID-19 pandemic, as I am concerned also about the very situation in the world. And so I am glad to be with you in order to share and exchange knowledge on what the situation is and how we can remedy the situation.
That's wonderful. Where specifically do you join us from this morning?
Well, I'm currently based on assignment in the United States of America. I had just returned in the last couple of weeks from Africa, and now carrying on my duties here in the United States with the Maryland Medical Reserve Corps that is also fighting and combating the COVID-19 pandemic through various means, diagnostics, currently through vaccination, and through intensive mass public health awareness campaign.
Well, it's a pleasure to have you this morning. We'd like to say welcome to the Brush Morning Talk. Welcome to the National Discourse. Well, Dr. Young, let's begin with the issue of the deadly coronavirus. There are many of us librarians who don't know exactly when people say coronavirus, COVID-19. I mean, they're just following the preventive measures, but they are having understood in depth what exactly it does, how it go about doing it, and so forth. Can you talk to us briefly about coronavirus in totality?
Well, to summarize, coronavirus, which is that family of viruses called Coronaviridae, is this particular coronavirus 2 is a member of that family, which is called the SARS-CoV-2. About 10 to 15 years ago, there was the SARS-CoV-1. This SARS-CoV-2 erupted around November, December of 2019, emanating from Wuhan, China, and then cross-transmitting around the world. This is a respiratory disease. That means we contract or we get the disease, we get this virus through what we call air droplets and through the air. When one who is infected with this virus sneezes or coughs, there are those little droplets that that comes from our mouths or our noses. And if you are a healthy person, inhaling these droplets or coming in contact with these droplets through inhalation, through breathing in, you then get them in, and these droplets settle down along your respiratory tract, your breathing tract. That means through your nose, all the way going down to your lungs. This virus settles down in your lungs, mainly where they have receptors called the ACE receptors. That's where the virus settles, and then it begins to cause the disease we now call COVID-19. Now, when you contract it, the symptoms you show are, among others, high fever, headache, You also begin to sneeze. You may lose taste. You may lose your sense of smelling. You may have sense of vomiting, which we call nausea. You may also have diarrhea, and many other symptoms. You may also experience fatigue, which is weakness, and several other symptoms. But one of the most crucial symptom is the breathing difficulty. As I told you, the virus attacks the lungs mainly. And so when it attacks those areas of the lungs where we carry out our air exchange, you then have the situation of breathing difficulties. I'm just trying to make it as simple as possible so that our listening audience will understand it. And when you have these breathing difficulties and we don't treat you in time, like giving you oxygen, for example, for which we need these oxygens, and it may lead to death. And so the symptoms range from what we call now asymptomatic, meaning you may have this virus and you may not present symptoms. You may not show any symptoms at all. And that has been happening in the Liberian population for the last several months. And you may have mild symptoms, meaning you may show fever, slight fever, and then you may not have these breathing difficulties that we are talking about. You may have headache, and then you may have severe symptoms, which then will include this very severe breathing difficulties that may possibly lead to death if not treated. So that is a short summary of this virus, what it is, the disease it causes, and the symptoms that anybody who is infected with this disease may show or may not show if that person is asymptomatically infected.
So now let's look at the issue of transmission and contraction. How do people wearing get this virus? How the virus really spread out? We see people wearing nose mask only.
And as stated earlier, the virus is a respiratory virus. We have come to know that it is transmitted through the air, through respiratory droplets, through the sneezing. If one is infected and that person sneezes, as you know, usually we spit out those little bubbles, if I can put it that way, that if another person who is not infected inhales those bubbles and come in contact with them, that person could then become infected. So that is why one of the major regulations we put in place has been the mask wearing of masks. Because if you are wearing masks and a person who is possibly infected is also wearing masks, if that person sneezes, the chances of you becoming infected are very, very slim, because then the mask will be there to catch, those respiratory droplets. And on your end, if you have on the mask, even if some of the respiratory droplets manage to escape through some of the holes, your mask will be able to prevent those respiratory droplets from getting into you. And that is why the mask wearing is very important. Now, we also say keep what we call social and our physical distance. It is because these droplets, as we have seen scientifically, they travel about, say, 6 feet.
Okay.
So if you keep, they travel about 4 to 5 feet. So if you keep about 6 feet or more away from people, you are also sure of not being, in contact with the droplets. And that is why we say people should keep about 6 feet or more away from other people, for which you see at the airports, in very, very marked airport, you see those areas that are marked that you should keep 6 feet distance away from others. Also, we ask you to sanitize your hands consistently and wash your hands consistently, because these droplets may be on certain surfaces that you may immediately touch. And once you touch them, you come in contact with your hands, and you bring your hands right on your face or to your mouth by eating something or, putting your hand in your mouth just for anything, you may introduce the virus into yourself. And that way you also contract the virus. And that is why we always ask for, we warn that people wash their hands constantly and sanitize their hands constantly. Now, the next thing, which I probably believe we will be discussing also, is the question of the vaccines as well. Which eligible persons should take, and those vaccines will help to prevent infection. They will prevent hospitalization, meaning they will prevent you from going to a hospital, and then they will prevent deaths, because if it is possible that you become sick with this virus and you have been vaccinated and you come in contact with the virus, there's a high possibility, given the efficacy, how efficient the vaccines are and how safe they are, you will not be sick from this virus when you come in contact with it.
Now, Dr. Young, another thing in Liberia, recent Liberia Chief Medical Officer Dr. Francis Cattell announced, the shortages of the AstraZeneca vaccine country. What threat does this pose?
Everywhere around the world, we are vaccinating. When I say we, I mean public health personnel, medical personnel, scientific personnel. The whole world is presently at the stage of vaccination. This is now the stage of immense and direct intervention. So countries have secured vaccines, and other countries, which are the low to middle income countries or poor countries, got some vaccines from an organization called Gavi, which is the Vaccine Alliance. Liberia is among those countries that got its stock of vaccines from Gavi. The vaccines given to the vaccine quota for Liberia is around 340,000, according to the February 2020 Gavi distribution list. Now, Liberia was sent a quota of about 75 to 96,000 doses. And that meant that if you divide that into two, let's just put it at 100 for the sake of the mathematics. If you divide that by two, that means each person getting the vaccine should get 2 doses, and that means you will have 50,000, 45 to 50,000 persons getting that vaccine stock that was sent to Liberia. But the vaccine has run out. Why? Because of the manner in which the vaccines were distributed by the National Public Health Institute, the Ministry of Health, and the Incident Management System together. Some of the vaccines were sent in the Leeward counties, and some vaccines were being administered in Monrovia. Now, according to the public health and health officials in Liberia, they have run out of vaccines. What we don't know is how many persons have gotten this vaccine. We need to know those data through what we call public health transparency. We need to know how many persons have gotten this 96,000 doses already for which the vaccines ran out. Now, if they say the vaccines ran out, why is it that it's been reported by the health ministry that they are trying to retrieve vaccines from the Leeward counties? So that's a very major question we need to understand. One of our concerns also was the expiration of these vaccines. The vaccines were due to expire sometimes in July. So how much of these vaccines were administered into people's arms, and how much of the vaccines have not yet been administered? Are the vaccines nearing expiration, or have the vaccines expired for which we don't have vaccines? This information needs to come out from the public health authorities in Liberia. So it spells out a very grave situation with the lack of vaccines and the increase in cases that we are seeing in the country presently. Remember, I was in the country, and far before then, I had consistently warned that we had this virus that was this COVID-19 or COVID-2 virus that was going throughout our community. But because we did not have enough and robust testing capacity, our country's healthcare authorities could not determine how fast and how pervasive the virus was. And I indicated that we will see a very serious situation in terms of the spike in this virus in the future, and particularly so with the strains, these variants that are coming out, whereby we have the Delta variant and various other variants, which some of which we are presently confronted with. So the lack of vaccines in the country presently poses a very serious problem for our healthcare system.
So in moving forward, what do you suggest that?
I have suggested in time past that the Liberian government needed to purchase vaccines. We had the money to do that. Why do I say so? The Liberian government sourced about $30 to $50 million, whether from the IMF or from the World Bank sources, but they did source that money. The money accordingly was delegated to be used for feeding. And my suggestion at the time was that we did not need to use this money for feeding. $50 million, about 10 or 20 million of that could have been invested into the vaccine producing companies, so that when the vaccines were ready, we could have our choice of vaccines that we needed. And that way we would not go begging for vaccines, and we will not go waiting for vaccine. Secondly, that we could have used some of that $50 million to develop our own testing kits. As you will also note, there is a serious shortages, or in fact, lack of testing kits in the country, for which we don't have any good testing capacity in the country, at the airports, at the various testing, at the only testing center that we have, we don't testing kits. I understand France had donated some testing kits sometime back in June. From the communication we've seen from the French embassy, sometimes in June, they had donated some testing kits, which had not yet come into the country up to the time of the president's visit to Paris, or they were already in the country, as we already saw that letter. So this is the problem that we had. That money could have been used for those two purposes: robust testing and vaccination. So if we had $10 to $20 million invested into vaccines, we would have had stockpile of vaccines into our country. We would have had not only AstraZeneca, but probably we would have had Pfizer or Moderna, so that we have, the three different types of vaccines, enough to vaccinate 5.2 million people that we have.
So now, as a matter of fact, you are an infectious disease scientist, and so I'm so concerned. I mean, per your research and investigation, how do you grade the AstraZeneca vaccine?
From the scientific data that we have seen and the analysis that we have done, we know that all of the vaccines that have been given what we call emergency use authorization, meaning that they have not approved them fully, but because of the pandemic, this global health crisis, they have been given some sort of authorization, which is called emergency use authorization, by the US Food and Drug Administration and the European Medicine Agency, medical agency. So the AstraZeneca vaccine has been approved in Europe by the European Medical Agency. The vaccine have been determined to be effective and they are safe. The vaccine have about 82 to 86, 84, 86% efficacy. So it is very good. And the vaccine has been used in most of Europe and other countries around the world, except for the United States, where they are still looking at the documents submitted to the regulatory agency for approval. So the vaccines are good. And they are safe. When administered in those 2-dose format or 2-dose regimen, the vaccines will save life and they will prevent you from hospitalization. Yes, certainly we have seen some side effects of the vaccine, like any other vaccine. the vaccine show side effects such as fever or sore on the injection arm, and some people present with headache. And one of the very rare side effects has been this blood clotting, which I dealt with extensively during my visit to Liberia, during those public health awareness exercises that we carry out. And so the vaccines are safe, they are effective, and they can prevent COVID-19 infection, prevent hospitalization, and prevent death, as the clinical trial data have shown.
Great. So let's move to the, looking at the fight against COVID-19. Let's look at the political aspect of this. As a matter of fact, the issue of politicians, trooping, doing the fight of, this pandemic is something you cannot underestimate as well. Right now, there are lots of politicians in Liberia, including some of those in positions, some of those oppositions as well. And they have that versatile view, in the fight against COVID-19. But how are you looking at the politicians and their responses to COVID?
One of the things is that people should make this particular pandemic response devoid of politics. This is not a time for this political showcase of distributing buckets with pictures of politicians on them. This is not the time for that. This is not the time for politicians using this pandemic as a carrot stick to entice each other or to entice the population. This is not the time for politicians to create this unnecessary sense of political campaign. On the contrary, to the betterment of this situation, this is the time for us to collectively work together to employ, meaning to bring in the expertise that are trained to carry out pandemic epidemiological response, to handle the vaccine, to handle the pandemic in terms of diagnostics, in terms of vaccination, and in terms of public health awareness, as well as contact tracing. These are the specific areas that are needed, which no politician can, actively or do, if I can put it that way. This requires expertise. This requires practical work. And it's not a situation where you go to entice voters. And so my advice is that politicians should stay out of this pandemic response with the intrigues that we have been seeing, enticing the voters while our people are dying, while people are sick. This is not time for politics. This is the time for serious work in order to beat back and end this pandemic, just as we did with the Ebola outbreak in 2014, when we were able to defeat it. And so I will admonish our people to be steadfast, to follow the public health regulations, which I hope are being enforced, which are wearing of masks, keeping your distances, and of course, the major one, going to take your vaccines when vaccines become available in the country.
So now, God, as a matter of fact, in the fight against this pandemic and on epidemic, when in 2014, when the that's the Ebola virus outbreak, took a tour across some African and West African nations as well. The issue of financial support has been some of the challenges confronting health authorities in the country. Now, of recent, there were controversies, centering around some 15,000 United States dollars that were received, by legislators up Capitol Hill, and Senator DeLong of Moss Raleigh County, took a share of that controversial 15,000 and donated 7,500 to the Moss Raleigh County F10. But earlier on, there were claims of rejection and so forth. What can you say to this?
First and foremost, the lack of enough budgetary support to the pandemic effort by the government has caused this pandemic response to be very problematic. That is why today we don't have testing kits. That is why today we don't have vaccines, whereby other countries properly planned and apportioned a good bit of their budget during this pandemic to the pandemic response in their countries. Countries like Ghana, countries like Rwanda, South Africa, and I can name them, on and on and on. I had hoped that our country, Liberia, had paid more attention to the advice that we were given from the inception, gave more money to this pandemic response so that healthcare workers can be paid on time, so that we can have enough PPEs, these personal protective equipment, so that we can source enough vaccines, so that we can source enough testing kits in the country to carry out robust mass testing, so that we can have an idea as to how the virus is spreading, so that we can carry out scientific contact tracing by utilizing the 2,000 trained or 2,000 plus trained contact tracers and other public health personnel that we trained during the Ebola outbreak, so that we can pay some of our young public health cadets, for example, students of public health that would have been employed to do their practical activities during this pandemic response. All of that money would have been used for that, so that some of that money could have also been used to buy, masks, to supply our people with masks and masks. The masks are so cheap now, and that our country could have afforded to provide masks for each citizen. So this $15,000 that was given to each of the legislators is of serious concern, because that money amounted to about $3.5 to $4 million. And so imagine how much $3.5 to $4 million could have done if it was deposited in an account that could have been used directly for pandemic response. It is not the prerogative of the legislature to go and give piecemeal assistance to the executive branch, which is represented by the Ministry of Health in their particular districts, to carry out pandemic response. So I think this allocation of the $15,000 each for these legislatures for so-called community engagement was very much inappropriate. And my proposal was that that money should be returned so that it can be pooled and it can be used for the pandemic response in terms of getting vaccinations, which we have run out of already. If we had that $3.5 to $4 million in our hands now, we could have gotten about 2 million doses of the Johnson & Johnson vaccines directly into Liberia without waiting for Gavi or any other organization. So I would think that the legislature have not done our population any justice by taking that money and utilizing it individually the way they are now doing.
So that another thing I want us to look at is your own contribution towards the fight against the pandemic. You have been in almost most of all over the countries, carry on awareness. Do you care to maybe accept any effort from President George Manning Weah, maybe appointing you as one of the committees to spearhead the COVID-19 epidemic?
I have made numerous offers, as you know, from documents that you've seen, to the Liberian government to help in the pandemic response, just as I did during the Ebola outbreak. And it is not just me; it is a group of diaspora and other public health, medical, and scientific expertise out here and in the country that are willing to give our services for free. And I wrote the government already several times. I have written the government that I could develop Liberia's own testing kits. The government did not respond. And today we have shortage of testing kits in the country. I consistently told the government I would come in to contribute my quota, that they should make the appropriate arrangements. I can't just step into the country. Nevertheless, during my visit to Ghana at the conference and the pandemic response in Ghana, after that exercise, I also indicated to the government that I was coming into the country, and I wrote them officially. The government received the letter through the Ministry of States for Presidential Affairs through Minister McGill's office. Minister McGill is aware of this. Dr. Francis Kitty is aware of this, and several other officials are aware of this. The legislature is aware of this as well. The government did not respond. I nevertheless went into the country, as you heard and as you saw, and carried out extensive awareness when none of that was going on in the country, over radio stations, over television stations, and in the communities. And through that, the public became initially then convinced that they were getting the right message that they needed. So I waited and asked for the government to find out what I could do officially, since I was doing my own unofficial work at the time in the country, but the government did not respond. And so after 3 weeks of stay in the country and working to the best of my ability, serving the country, I had to leave because I had other assignments. And so that's where we are. I am ever ready and ever available. Other colleagues of mine are also available. It is the honors of the government to see whether it can arrange for us to come back in the country anytime based on mutual arrangements. So certainly we are ready to come once the arrangements are made. So please send that message back to President Weah. And at any point in time, if you have any of these officials on your show, I think the question goes to them: why have they not invited us, and why have they not opened up their arms and on the official end of things, given that go ahead or given that official invitation for us to come in?
I think it's the right of every Liberian to contribute their quota to their country. What is your close relationship with this government?
Well, as a member of that society, I'm part of the government. The government makes regulations, and I have to adhere to those regulations. As a citizen, I'm part of the government. So the government is not just those who are in authority. The government is all of us. We, the people, make the government. We, the people, put the government in power. We vote for the government. And that is the kind of relationship that all of us, not just me, have with the government. And so we, the people, also have the power to effect changes in the government. And it's not just removing the government, but making suggestions and making our offers and making our quota to the government to help improve the situation of our people. So I have made my offers as a citizen to the government to come in and do what I can do best in terms of medicine, science, and public health response. And that is the level of relationship that I have with the government and the people of Liberia, as well as the people of Africa and the world as a whole.
Now, let's take a keen look at the issue of the pandemic health regulations. There are lots of regulations that have been announced by the CDC, the World Health Organization, and several ministries, health authorities in several countries where the virus have been ravaging as well. I mean, what do you make of the issue of the pandemic health regulations?
They have regulations that have been put in place around the world, among which are the major ones, which are this wearing of masks. You will recall that I was one of those first earlier scientists who called for the wearing of masks. And in Liberia and around Africa, we supported the African Prince cloth masks being worn, when around the world it was being said that, you know, we should leave this whole mask wearing only with the public health personnel, you know, frontline workers, doctors, and we were saying that no, the mask wearing will reduce or will help to fight back this virus. You see today, there's a major public health regulation. Finally, the world has agreed that we wear masks. The second thing was keeping our distances. That was one other regulation put in place. The next thing was, you know, not touching surfaces, sanitizing your hands, washing your hands. These are general regulations that are put in place. Regulations that were put in place individually according to countries and worldwide, according to specific countries, were locking down of the country so as to prevent infected persons outside of the country from coming into the country and, you know, bringing the virus into the country, what we call this cross-border transmission. And there was also the situation of, you know, another policy was feeding the population. So the policies were meant to be applied according to the individual situations in a particular country and a particular health jurisdiction. And it was, these regulations were not blanket regulations that will cover everybody. So the regulations are effective in preventing the COVID-19 infection when applied. As you can see, because we have not applied effectively the question of this lockdown and this contact tracing and the testing, mass testing, which is a regulation also, you see that we have had the infected persons from other countries coming into Liberia and spreading the virus. That has been validated. When I did warn that given the travel and interaction presently in the recent times between Liberia and India and China, with travelers coming between the two countries and the virus raging in India, particularly with the Delta variant raging in India, we could possibly have that virus transmitting into Liberia. What did we see? Several months after, in fact, 2 weeks after I left the country, we saw a spike in cases. So if these regulations are properly implemented, effectively implemented, they can go a long way in preventing these huge spikes that we see in various countries. Our country is not at a situation where it is able to mount an effective response, as we have seen. Unlike other countries like Rwanda or Ghana, and if you take it outside of Africa, like the United States and major Western countries that have the capability to produce masks, the capability to produce sanitizers, and have vast expertise that can mount these responses. That is my view of the current situation with respect to the pandemic regulations. And so the regulations that have been put in place in Liberia should be effectively enforced. That's one area where our country is lacking, enforcement. Another area is strategy in enforcement. The country lacks the actual strategy in enforcing these regulations. So you can tell anybody to wear masks. You can tell anybody to social distance. But how do you enforce these regulations? And how do you strategically enforce these regulations? So those are two areas, two major areas where our country's pandemic response is also lacking. For those following us on the other social media platform, I see on my screen a freeze. I probably think their screen is frozen in studio, and I am not getting any more voice from them. So I hope they were hearing me. I'm waiting for them to reconnect so that we can continue this discussion. As you will note, the entire... Okay, I'm getting signals now.
Are you getting us now?
Yes, I'm getting you now.
Yeah, so you were discussing the regulations, and I was asking what your suggestions, what are some or strategy you think can be put in place to enforce the regulation?
You see, this is where collegial discussion from a professional standpoint comes in. It's just difficult to, we have already given these regulations. Now it's difficult to give specific examples and strategies because you can say things, but how is it going to be implemented at the other end becomes the question. We can only hope that the time will avail itself for colleagues in the country to avail themselves to the offers that we are making so that we as professionals from here can interact and exchange information in terms of pandemic response strategy and specific suggestions as to how these strategies can be implemented.
Now, that I'm so concerned, there have been lots of debates centering around the issue of, compulsive lockdown. There are other health experts who have called on the government to lock down the nation amid COVID-19. And there are some who hold a view as well that, by declaring a lockdown, it won't help the process as well. What's the perspective? What's your view on the issue of locking down the country to curtail the further spread of the virus, leave the border open, and everyone, what about doing that normal things?
This is where strategy and specific intervention comes in. During the early stages of the pandemic outbreak, I was one of the first scientists who called for lockdown in Liberia. The government health authorities kicked back at a time, refused that. Only later on to actually lock down the country. Like I said, locking down the country prevents infections from coming from the outside, being brought in by travelers into the country. From what we have seen, the country has already been, if I can put it that way, pandemically infiltrated. Meaning that there have been a lot of infected persons who have come into the country already. And equally so, there are a lot of infected persons that are leaving the country. So we don't want to transmit viruses to our neighbors, and we don't want our neighboring countries or outside countries transmitting the virus to us. This is where it becomes very critical. As you can see, Liberia has been put on a level 4 watch list by the U.S. Center for Disease Control, and it has been declared as a hotspot by our neighboring country, Ghana. And so what do we do at the moment? Do we lock down or do we not lock down? As you said, that's the question. I think this is something that the health authorities in the country should actively study, given the dynamics and the trend of the infection. The increase in infection, the increase in deaths, looking at those trends in order to inform themselves through the data whether there is a need to lock down the country or there is not a need. If I were in the country specifically participating in this pandemic response, I would have made a specific decision on what needs to be done.
So as it stands, you keep that yet?
Well, again, it is within the hands of the health authorities to make these decisions, because we can suggest, but whether the health authorities will listen, since they have not listened in the past, is another question. So it is needed for, number one, the entire pandemic response system to be revitalized, because you have in the incident management system and the National Public Health Institute arrangement, unprofessional representation and unskilled and unspecified representation of people who are not knowledgeable about health, about epidemiology, about science, and about biotechnology and infectious diseases. These are the particular expertise that you need on an incident management system in order to mount an effective response. We saw how the United States of America faltered and was lagging behind in its response because of the way the previous administration in the US handled the pandemic response. Today, we are seeing how President Biden, when he came in, reorganized the pandemic response, put in place the qualified people, including Dr. Anthony Fauci and several others, in order to mount the pandemic response. We see how it has been going in the United States of America as opposed to what it was in the past. So once these things are done, I think that group of people with the expertise are able to discuss and advise each other and advise the president appropriately as to what needs to be done in terms of whether locking down, in terms of contact tracing, in terms of diagnostics. As you know, our diagnostics have been problematic. We have only one diagnostic center in the country for a population of 4.5 to 5 million people. So all of these require a reorganization of the pandemic response in order to make these decisions. Otherwise, we can make suggestions, but whether they will be implemented is another question. And we know that these suggestions have never been implemented in time enough.
So that as a matter of fact, I mean, during the first wave of the coronavirus in Liberia, I mean, the World Food Program, WFP, through partnership with the Liberian government, they began the issue of the ration distribution. And according to report, when the chairman on that committee, Professor Wilson Tappe, he said that, I mean, it made a tremendous mark, Liberians across receive these similar packages and so forth, but there have been controversies. I mean, looking at the intervention of the World Food Program and the current situation that is prevailing in Liberia, what can you say specifically with where we have the issue of Liberians, catching difficulties as a result of the negative effect of the COVID-19 and the issue of the shortages of food, and these are practical occurrences in country. The effort of the WFP, you blend that with the government response. What do you say with the issue of foreign aid?
Firstly, at this day and age, with Liberia reaching 174th year, should not be talking about food insufficiency. By now, we should have been self-sufficient in food production with the very arable land that we have for food cultivation. That is a national weakness. That is a systemic weakness. And I hope future governments will address this question of feeding and food self-sufficiency in Liberia. The World Food Program of feeding Liberians in partnership with the Liberian government that was introduced during this pandemic, I am on record of saying that it was unnecessary. Because at the time as the feeding program was kicked in, that's when the lockdown was removed. My contention was, if you source this $30 million, $30 to $50 million for feeding, and I indicated that earlier, at this particular point in time, our people are not locked down. They are not in a position where they cannot go to the markets anymore, and they may not necessarily need this feeding. Secondly, the mechanisms put in place for this distribution is subject to corruption, is subject to misappropriation, and it is also subject to misapplication. And people saw that as, political, but this was the reality. You see, we analyze this situation and look far ahead. What happened several months after? The president and several government officials have come out to question this particular feeding program. I have suggested that money be used to produce our own testing kits so that we don't have shortages of testing kits today. I suggested that money be used to source vaccines into the country so that we don't have the shortages of vaccines that we have today. So the feeding program was unnecessary. It was something put in place that was liable to misappropriation, corruption, and misapplication. And we are seeing that happening today. Everybody is questioning it, including the very government that put the system in place. So that is my take on that. And I hope that wherever that money went, that money can be recovered. It is my knowledge that, the WFP have refused to be audited. Why it has refused to be audited when the Liberian people's money was given to it to carry out this feeding program is a question to be answered. There is corruption in the system with respect to this pandemic response, and we have to be very, very careful. There cannot be corruption if there is not a collaboration with certain persons, and if it is not being done collectively among certain persons. So we have to dig down into what is happening with this pandemic response. You may be talking about the World Food Program. Another situation is, in fact, the testing feeds that have been collected at the airport. If you calculate that, on an average, monthly, there is about $1 million to $2 million collected from the testing arrangement at the airport. What happens to that money for which we don't have testing kits in the country? These are all facets of our pandemic response that are problematic that we as a country need to look at. And I hope the president is really looking into these things.
Well, that's the voice of Dr. Duba Christian. Of course, he's an infectious disease scientist, and Dr. Yo is our guest this morning. You following him, he's discussing lengthily the Delta coronavirus. We talked about the issue of vaccine shortages, politicians' responses to the fight against COVID-19. And at this juncture, we can begin to take your call right now. We can begin to hear your views on the Brush Morning Talk this morning. And today's Friday, July 9, 2021. It is a very bright Friday morning here in Liberia. And you can call us on 0880-346-169. Again, 0880-346-169 are the numbers this morning to allow you forming part of the Brush Morning Talk here on Brush FM 94.7 MHz.
I may not be able to hear the questions because I am, again, disconnected from the studio. Hopefully, okay, they're back. Okay.
So 080-346-169-0776-340-979, 0776-360-979, 0880-346-169. The numbers this morning to have you forming part of the program, 080-346-169-0776, 360-979 are the numbers this morning. Good morning. What's the name and where have you called from?
Good morning.
Good morning, sir. What's the name and where have you joined the conversation from?
My name is Janelle Johnson, and I called from district number 9 this morning.
Go ahead, Jamel. You listening to?
I want to appreciate you the field just this morning's program, and then the issue about government. I have some whereby they want to put for lifetime again, but that's not going to work because first lifetime that they put out, the best money is for the first money that they got. The personal package they talk about. You know, anything up to now, most people are not receiving their package. So when you call a last time, you misuse the first money that they give you. That's the problem we're facing now in the country.
Okay, Chief. Thank you very much this morning for forming part of the conversation. We appreciate your time, sir. Thank you very much.
Okay.
080-346-169-0776-360-979. 080-346-169-0776-360-979 are the numbers to allow you form part of the Brush Morning Talk this morning on Brush FM 94.7 MHz, Brush TV Live on SEM TV respectively. Call us on 080-346-169, 0776-360-979. Good morning.
Good morning.
Good morning, sir. What's the name and where have you come from?
Yes, I'm calling from FDA.
Go ahead, sir. You following infectious disease scientist Dr. Duba Christian.
First of all, I want to thank the platform guest, Dr. Christian. He explained recently concerning what is occurring in countries and how can the citizen rate of our country can go about avoiding the virus by using the mask. What I want to understand, there has been this agreement in some form concerning the AstraZeneca. Some politicians, it seems politicizing has been having side effects. So how effective, how good, and what assurance can Dr. Young can tell the listening public as to this AstraZeneca?
You're talking about how reliable is the vaccine, right?
Exactly.
Okay, Chief, keep listening and our guests will respond to you. Just keep following Brush FM 94.7 megahertz, Brush TV Live and SEM TV respectively. Call us on 080-3461-690776 0979 again 0776360979 080-3461-69 are the numbers to allow you to form part of the Brush Morning Talk this morning. This morning we have infectious disease scientist Dr. Duba Christian, and he's providing his expertise on the coronavirus, its prevention, its regulations, and how it can be curtailed as well. And I guess some of you following the platform wanting to comment, whether it is an inquiry or whether it is a comment that you want to be direct across 0880-3461-690776 360979. Good morning.
Good morning.
Good morning, sir. What's your name?
I'm Gene Emmanuel.
Yeah, Emmanuel. Let's hear you. Welcome to the BMT this morning.
Well, thank you. First, let me say this. Thank you for this enlightenment. But it's something I really want to know about the vaccine. Well, if you have any online complication, is it advisable that you take the vaccine?
Okay, sir. Dr. Yang will respond to that question. If there are other issues you have with your health, can you still go about, getting vaccinated? That's the question, right?
Yeah. And another thing is that I want to know how secure or how safe is the AstraZeneca vaccine? Because for other countries like Italy, created drug for people, in other countries. I think this Africa, there was a country that created their environment. And how safe is this vaccine? How safe is this vaccine?
Okay, sir. Keep listening, and our guests will definitely respond to that question. Just keep listening, keep following the platform this morning.
Okay, thank you.
You're welcome.
I think we can allow for that to respond to the three call-ups and then take additional calls.
Okay, so Dan, welcome back to the presentation this morning.
Good morning, sir.
Oh, good morning. Let me squeeze you in quickly. What's the name?
Good morning to your usual guest.
What's the name and where you join us from?
I'm Brian calling from Soklin, District 4.
Go ahead, Chief. Let's hear you.
Yeah, I want to ask Dr. Nan if he were part, if you were head of infield, what would be a fast the predatory alarming to Freddy disease? That's what I want to know. How much will he need to tangle the disease, the virus?
Okay, Chief. Thank you very much for putting through your view this morning. Dr. Yang will respond to your inquiry. Great. So let's rejoin Dr. Yang this morning. He's our guest on the Brush Morning Talk, the BMT here on Brush FM 94.7 megahertz, Brush TV Live and SEM TV respectively. Well, that many of the callers are concerned about how how trusted is the AstraZeneca vaccine? And another one is so concerned about why, in case there are other health problems, and that you have, you might be suffering from, something other than coronavirus. Can you still make your way to this vaccination site, to be vaccinated? How I mean, the effect of it cannot be done. I mean, those were questions the callers are asking.
Thank you very much. These are very legitimate questions that have been, asked, and legitimate concerns that the population have. And these are concerns that, in my opinion, the public health authorities should have been addressing regularly on air, utilizing the state radio, so as to provide the kind of awareness. When we talk about awareness, these are the kind of questions that people, professionals address. As I stated earlier, the vaccines are safe. The AstraZeneca vaccine, throughout the clinical trials, were proven to be safe and proven to be effective against the virus. There are side effects like any other vaccine. Any other vaccine you take, you will have these side effects, which will include pain on the injection site, fever, headache. You will have these particular symptoms. And the listener talk about the issue of blood clot, which I also addressed earlier on. Mm-hmm. The issue of blood clot with the AstraZeneca vaccine was noticed far after the clinical trials, after it was approved, once it got into the population. Now, about 50 million or so doses of this vaccine have been administered already, and we saw in total about, say, less than 200, about 200 or less cases of this blood clot, and just few deaths among that. Let me hasten to add that the Johnson & Johnson vaccine, which is also similar to the way AstraZeneca was produced, also showed the same symptoms of this blood clot. This issue is very rare. When we talk about rare, meaning that it hardly happens. It's hard to find. Let me put it very simply in our Liberian English for our international audience listening. It's hard to find. It's hard to see. So you should not be afraid. Imagine out of, let's just say the United States, out of about 10 to 20 million doses of that given, only 20 persons had this blood clot, and I think about 1 person died. So if you look at 1 person dying out of 20 million, that is very negligible. But look at how many people have died from the COVID infection itself. Globally, we have 4 million deaths from COVID. 4 million deaths from COVID. Look at Liberia itself. In Liberia, we have we'll soon be reaching almost 200 deaths from COVID. But we have not had a single death from the vaccine that have been given already. AstraZeneca have been given in Liberia, and we are not seeing any death from AstraZeneca vaccine. So I want you, from this public health awareness, which I also carried out when I was in the country, I want you to kindly listen to me very keenly. The vaccines are safe. The vaccines are effective. That particular side effect is very rare, and it is less likely to happen. In fact, you are more to have more benefit from taking the vaccine than if you didn't take it. You see the amount of people that are dying presently in a country. It's simply those unvaccinated persons that are dying. If you look at the United States, 90 to 95% of the deaths presently in the United States are people who did not take vaccines. So if you are unvaccinated, if you are not vaccinated, your chances of dying is almost like 95% than if you took the vaccine. So please take the vaccine. The vaccines are effective. One of my problems is with government officials trying to explain public health issues which they have no knowledge about. As I understand, one of the government officials was terminated from the Ministry of Information about a week or two ago for, according to the government's release, for giving misinformation about the pandemic. And this is the problem that we have, that some government officials try to give information about the public health response, about the vaccines that they have no knowledge about. Another problem is that the public health authorities themselves are not explaining the science behind the vaccines. And this is where you need people who understand the science, who understand the pandemic response, who understand epidemiology to come in and help with the response. They don't need money like myself. We don't need any money from the government. We don't need any pay from the government to do that. It will be done for free. So they shouldn't be afraid. Secondly, we are not coming to take anybody's job from them. So rest assured you will keep your jobs. We don't need your jobs. We only want to come to help our people so that we help with our skills to fight this pandemic for the safety of our people and not politicizing it and not misinforming our people. The second issue of if you have any particular sickness or disease, if you can still take the vaccine. My answer to that would be specific, yes. That's one of the reasons why we say take the vaccines. The vaccine is meant for people who have, for example, what we call underlying conditions, meaning people who have other health issues, people who have diabetes, people who have HIV/AIDS and their immune system cannot fight back the virus because their immune system is down, people who have other immune system problem. Let me just make it simple, immunological problem. People who have heart condition, high blood pressure, people who have various other health conditions that will make them not to fight the virus. That is why you definitely need the vaccine, because the vaccine will help you to produce those things in your body, which we call antibody, that will help you to fight back the virus, that your body will not have done because you are sick, because you have these underlying conditions. So yes, people with underlying conditions are prime candidates for taking this vaccine.
No, I mean, the other caller was so concerned about, for example, you are invited or you are the head of the National Public Health Institute of Liberia.
Exactly so.
I mean, how much will it cost you right now? What could be a proposal to the government? How much do you need as head of NPHIL for any reason you have been, to combat the deadly coronavirus?
I think these kind of specific discussions should be left with if the government had invited our team from here of experts, which include public health personnel, which include diagnostic personnel, epidemiologists, nurses, diagnostic expertise. All of that should be left with seeing what the government has as a government for a budget to fight the pandemic. To this date, we do not know. And so those specific discussions, I would think, if the government was open to discuss these things, those things should be discussed with government, so that we don't throw figures out there which will not be appropriate, which may be figures that are not figures that are not appropriately determined to fight back the pandemic. So I think these discussions should be left with government, and if the government invited any particular scientific team from here to go in there.
Okay, Dan. Let's move to the next point of discussion this morning. Now that we have spoken about the coronavirus, in depth, let's move to the issue of the establishment of the World Economic Crimes Court. I mean, this is a national issue that have been trending in country and abroad. It has drawn the eyebrows of several Liberians in country and in foreign lands as well. The debate has been, expanded. The debate continues to intensify, and there have been lots of issues. There have been several calls for the establishment of the World Economic Crimes Court. Let's get a backdrop first. The World Economic Crimes Court.
Well, the issue of the World Economic Crime Court has been delayed. This is something that should have happened long ago, so as to have people who were accused of participating in the 14-year civil war and probably other issues brought to justice, either through that particular fair system so that they are having the opportunity of exonerating themselves as well. On the other hand, victims and survivors of victims who have had justice being delivered through this process of the War Economic Crimes Court. And that would have been brought about, or that was proposed by at the time, the New Deal movement, which is part of the National Democratic Coalition. Many people don't know this history, where all of this started from. During the Accra peace talks, and during the process of those peace talks, the final peace talks that led to the cessation of the war for which we have peace today, the New Deal movement, which is now part of the National Democratic Coalition, proposed and was staunch about a Truth and Reconciliation Commission being established so that a war crimes court will also be established for purpose of bringing to book those who participated in killing our people and prosecuting this unnecessary civil war. That process had to be carried through our national legislature. Whether they have done it appropriately is the question that our citizens are still yearning for, and our citizens are still advocating. Today, you also see international participation, thanks to the US government that has been putting in pressure, thanks to various other governments that have been prosecuting former warlords in various countries, the recent one being in Switzerland, one of which was in one of the other European countries, and the US. We are seeing war criminals or perpetrators of war being prosecuted. The issue is of significant concern so that it brings closure, finally, to what went on during those 14 years of uncivil war and civil crisis that we had in the country. And so this is a burning issue that I will call on our government to address, to immediately institute the necessary legal mechanism that will put in place or that will set in motion the War Crimes Court being established on the Liberian soil in order to look into those war crimes, people who participated in the war, those who supported this war effort through various means, and for which we had this mass deaths in our country. About 250,000 plus people died, according to the estimate. That could be more, so that we can bring closure to this. It is necessary. Another aspect to this whole court issue is the economic crimes, that were also committed by several persons. Several persons have been charged of economic crimes. Is that true or is it not true? I think this court system, which we hope will be very judicial and impartial, will bring to bear the facts and the evidence as to whether these people participated in economic crimes or these people participated in war crimes, and so that we can bring closure to this. I will add that during the course of that time, that period, the war period and post-war period, we have had a proliferation of false academic credentials in our country. People are parading our streets, our offices, and our seats of government with false educational documents. This needs to be also investigated, for which we also won the War Academic Crimes Court. And that particular campaign, thanks to Martin, a very young advocate called Martin Colley, who have been advocating and exposing a lot of these individuals who are parading our offices and our corridors with fake academic degrees. It takes very long time for people to obtain PhD, for people to obtain masters. They sit in class or do regular, stringent online studies and hybrid studies to get their degrees. You can't have somebody just coming and presenting papers and telling you they have a PhD and you let them fly with no evaluation and with no vetting. So the War Economic Crimes Code and Academic Crimes Code are needed in Liberia to handle these problems.
In other words, you support the establishment of the War Crimes Code, the Economic Crimes Code, and the Academic Crimes Code.
In the affirmative.
So that are you one of the leading campaigners for the establishment of the Academic Crime Code?
As an advocate for social justice, sometimes when we talk about social justice, people are only thinking about human rights, violations. Mm-hmm. But social justice cuts across a lot of issues. And the war economic, the crimes that were committed during the wartime in terms of maiming our people, killing our people, and devastating our economy, as well as proliferating false academic degrees in our country, are issues that are very salient to the survival of our country. We don't want mediocres in our country. We don't want sycophants in our country. If you have education enough, you can stand on the basis of your education to do what you can do, and you cannot become a sycophant to anybody. You can become praise single. You cannot become a mediocre. And so that is the importance of these things. If we can put our economy in proper order without corruption, the money can be put into uplifting the deprived conditions of our people. And so all of this is very important. So as social rights and equal rights and social economic rights advocate, it is our duty to support these processes and make sure that they are done fairly without partiality.
Now, let's look at effort being applied thus far in establishing these schools. There have been, lots of public outcry, calling for the establishment of the War and Economic Crimes Code. I mean, of recent President Dr. George Barron, we have submitted, to the Liberian Senate, seeking their advice on how to proceed with the War and Economic Crimes Code as well. Looking at all of these efforts, I mean, of recent, Senator Prince Johnson, was elected to chair the Senate Committee on National Defense and Intelligence, and of course, just in a couple of times, he resigned a day or two ago from that committee. But we have Councilor Vani Sherman, who is also chairing the Senate Committee on Judiciary, one of those who are sanctioned by the U.S. Treasury Department for judiciary bribery. I mean, they are on some of these key, Senate committee. I mean, what do you make of this? Is the fight, to establish a one economic crime code, is it gaining some grounds thus far, per your own observation?
I will give thanks to those who are at the head of advocating this cause. One of whom is Emmanuel Service. His organization have actively advocated for War Crimes Code. Martin Colley, who have added the academic aspect to this whole code evaluation system of our country, and many others. Yasendi Kwehe Martin, and several others who I may not name now, that have been advocating this cause. And what we have seen is that it is catching on. The Liberian people themselves want this to happen. So it is not a matter of whether we want it or not. It is a matter of when does it happen. Our international friends, given their own international authorities and looking at what is happening in our country and their attachment to our country, have instituted certain policies that have affected or singled out those who have carried out, according to them, some of these crimes. The question of the U.S. Treasury sanctioning Senator Vani Sherman is a case in point, which can be laudable. the question of the U.S. and our own people putting pressure on some of those who have been accused of war crimes in our country is also laudable. Let this code be established so that people like Vani Sherman, Prince Johnson, George Bole, and several others who have led war efforts in our country during the 14-year civil war can be brought to justice so that they can either explain themselves or be exonerated. I think it is the chance for either conviction or exoneration, depending on how the evidence and the facts will go. So I will want to applaud all of those who are, at the helm, of this advocacy and supporting these efforts from the international end.
No, that I mean there have been series of concerns.
May I hasten to add that people should not be singled out also. That it should be very judicial, it should be fair and impartial, that it should not be targeted. This whole war and economic crime code should not be a targeted situation. It should be inclusive. It should not be singling people out just because you hate this person. No, the facts and evidence should speak for themselves.
Okay, Dad. I mean, there have been series of concerns, centering around the issue of who sponsors the code, how the code jurisdiction going to be, the entire setup of the code. I mean, there have been numerous concerns. There are all who are masquerading that the government don't have the funding to establish, these codes because it is cash intensive as well. And looking at all of what's happening. A seminar could was set up in Sierra Leone today, and I took former President Charles Taylor to the Hague. And so, I mean, many Liberians are still in doubt, and so many governments are saying the government is having a challenge with the issue of funding. Who sponsors the court?
Liberia has enough resources to do anything it wants to do if those resources, particularly financial resources, are put to proper use. If those financial resources are not diverted into people's pockets through corruption, we have enough money in that country. That should not be an excuse by the government. There are international entities that are willing to help in this process. We saw the same thing happening in Sierra Leone, just as you indicated. We saw that happening with the whole TRC situation, Truth and Reconciliation Commission in South Africa. If the government is serious, the government should not worry about where the money will come from. If the government is able to source $50 million for a feeding program, which has been turned into a flop, or which has been seen to be corrupt, how is it that the government cannot source any amount of money so that justice can be delivered for once? So I think it is an excuse for government or people within that cycle to say that the government does not have the money, the government does not have the capacity to do that. We have qualified people within our judicial system. We have human rights activists who are looking at both the rights of the accused and the rights of the victims that can adequately handle and impartially handle a war and economic as well as academic crimes court. So we have all of the pieces in place. We only need the political will to make that happen. And the fact that this present government campaigned on instituting or bringing into force the War and Economic Crimes Court, it is the obligation of this government to live up to its campaign promise by giving the people justice.
Now, Dr. Young, this is a question that concerns many Liberians. There have been lots of inquiry concerning this. I mean, what Liberians tend to benefit, if these codes are established?
We tend to benefit from the truth. We tend to benefit from the moral obligation for justice to be delivered. We tend to benefit from what we may term as a final closure of the wounds, those emotional and traumatic closures that people who are surviving today have felt from their relatives, their fathers, their mothers being killed right in front of them, only because they belong to a particular ethnic group or because they were educated. University students were killed. Some of my colleagues, including Wo Tapia, who is famously known in this situation, Mamadou Lavela, several others who we may not name because the names will cover the length of Liberia and beyond, have been killed by this war. And people need closure to this. You can only have a closure if you have an impartial investigation. These are, among others, some of the major benefits that people will accrue from this war and economic as well as academic crimes court when instituted and when it delivers justice to the people.
Now, Dr. Young, there's this belief, there are people who are perceived that, those calling for the establishment of the War and Economic Crimes Code, they are targeting certain group of individuals who might have committed, atrocities against humanity during the course of the Liberian Civil War. What can you say to them?
Well, I have said previously that this War and Economic Crimes Code, as well as the academic one that have been added to that, should not be targeted. If you go back to my answers, you will see that I said it should not be targeted. We shouldn't just target people. It should be meant for evaluating the entire process of this war. Who was involved? Who was not involved? Those that have been accused, so that they have their day in court to explain themselves after they have gone through this TROC, Truth and Reconciliation process, which has happened several years ago, so that they finally have this chance of sitting in the seat of justice in order to explain themselves. What role did they play, if any, so that they can either, they have the chance of exonerating themselves, so that victims or survivors of victims have the opportunity of hearing and seeing justice being done finally. So it should not be a targeted exercise. And this is the warning that I continue to sound also. This call for War and Economic Crimes Code should not be a targeted exercise. It should be an exercise intended for justice to be delivered impartially, irrespective of ethnic group, irrespective of social status, irrespective of gender, and irrespective of religion.
That another thing I want us to look at is your own contributions to Liberia. You have been creating awareness across the countries on COVID-19, and you have been speaking truth to power. Do you have any interest in serving the Liberian people, maybe it's in government?
Throughout my life, I have served the Liberian people, and I still serve them. I have never held a government position. The only government that I have worked with so far has been the U.S. government at the federal level and in various other capacities. Yes, the history exists that I fought for democracy in Liberia. I was prosecuted along with fellow pro-democracy advocates. I was exiled. I was in prison before being exiled. We were almost killed. And so the issue of service to our country has always been something that I have done. Presently, I come in the country and serve the country yearly, and as I presently am doing, by serving them through my professional expertise. I have the right to run for any office that the Liberian people will want me to run for. That any constituency that finds me qualified to run for will run for. And so that right is existing, and I can use that right at any point in time when it is suitable to run for a public office.
one thing I want us to look at is maybe if President Weir maybe want to maybe give you offer you the positions in government, will you accept it with the level of expertise you have?
At the present moment, and very consistently, I have offered to serve the country free of charge. I did that during the Madam Ellen Johnson Sirleaf's government. I served this country free of charge with my expertise. I did not want any positions. When the epidemic broke out, the Ebola epidemic, we worked hand in hand and brought that epidemic to a close very effectively, actively. This is the same offer that I continue to make to the government that I can also do. I come in the country yearly to teach at the university, at the various universities, to also train diagnostic expertise at the National Public Health Institute. I do that periodically every year. And thanks to the Africa Bio Incorporated, through those conferences, when I always come in, I take up time to render services to my people. I have participated in training of some of the very good batch of medical doctors that you see today in the country. I have done quite a lot and continue to do that. So the question of taking a job, from the government presently is nothing that is a near future situation, as I continue to offer my services free of charge to the Liberian people.
Okay, Dad. I mean, on the subject of establishing, the War and Economic Crimes Code, taking into consideration the TRC report. I mean, what do you make of the Senate recent intervention? When the president communicated of the Liberian Senate, and the Senate decided to set up a committee to be able to ably advise them on as to whether the court should be established or not. There have been.
I hope we didn't lose connection.
Oh, we are back now.
We are back.
Yeah.
We are back. Yeah.
Yeah, sure. So I was asking you. I mean, in the quest to establish the War and Economic Crimes Code, what do you make of the recent Senate, recent Senate reaction, talking about the Senate have decided to set up a committee so that the committee ably advise them on whether the code should be established or not? I mean, those things involved in setting up the War and Economic Crimes Code, the EFED, and several other things that centers around this subject. What do we make of the Senate intervention in response to President Weir communication?
Well, I first of all want to thank the president for taking up this issue and putting it before the lawmakers. As I indicated, the requisite mechanism for setting up the War and Economic Crimes Court now rests with the legislature through the recommendations that were made by the Truth and Reconciliation Commission. The bases were already laid out. I would think that the Senate should follow those procedures and the format in establishing the War and Economic Crimes Court and not delaying it by placing bottlenecks on its own way by setting up subcommittees to advise it again. It boggles the mind to understand what is there to be advised about. The process by now should be very straightforward. They should evoke the necessary clauses in the constitutions, in our constitution, the necessary laws, enact the necessary laws that will bring into force the War and Economic Crimes Court. That power rests with them, and they should utilize it instead of setting up other committees to advise them. The roadmap has already been laid, it is clear. And so the president has done his part. I will hope that the president will continue on to engage the legislature And I hope that advocates will continue to engage the legislature so that the legislature can do what it actually needs to do within the scope of its powers in order to have the War and Economic Crimes Code coming into being, and should not begin to delay it by setting up subcommittees to advise it on what it already knows and needs to do.
Okay, Dad. So let's go right there and pick up a few calls on the subject of the War and Economic Crimes Code right here on Brush Morning Talk. The BMT comes your way every weekday morning between 8 up to 10. Of course, we invite experts to the platform to share their professional opinions on some of the issues trending in Liberia and then as well. So this morning, this Friday morning, July 9, 2021 edition, we play host to Dr. Duba Christian. Dr. Yan is an infectious disease control scientist. Good morning.
Good morning.
Good morning, sir. What's the name and where have you joined us from?
I'm calling you from district number 2, Masharado County. I'm Joseph Kidem.
Go ahead. Let's hear your inquiry or comment this morning.
First of all, I want to thank the doctor on the show, especially following from the situation, the epidemic in our country, and he spoke natively. And there was one touching point that I have that we must retrospect is that Liberians are people who do not believe in what people tell them to be real. We Liberians are so doubtful. Many of the time when we ask and argue with them, people say, well, this thing is not real because we are not in there. Sometimes I ask and say, hey, so why would you love to see the dead die and you want to see other person die? So when anything happens, like in the Ebola day, people realize that we were being killed when we died and being put on trucks and people were burning.
Oh my God, we lost that quarter. I don't know for what that might be due to poor network connectivity this morning. But call us on 0880-346169 and 0776-360979. 0776-360979, 0880-346169. Our guest is Dr. Duba Christian. Of course, he is an infectious disease scientist. He's sharing his perspective all this morning on several national issues. You hear him talk about the coronavirus in totality, is prevention and control as well. You hear him talks about the regulations and so forth. Wow, this person, good morning. Lower down your monitor, sir. What's the name and where have you come from? Okay, madam, please, could you lower down the monitor? I mean, the feedbacks are too, they are too hard. Okay, much better. Go ahead.
Yeah. I'm just grateful to God this morning. But I didn't get me here this morning to listen to the doctor. There's information. Very important. Those are all our fortunate to set our behavior this morning. So what we learn from him will be able to deliver to other people that were not fortunate to be part of this program this morning. I want to be thankful to God for him. And my recommendation is, if you try and come and assist government to see how best you can be safe from this deadly disease.
Okay, madam. Thank you this morning for forming part of the Brush Morning Talk. Well, we can pick up our final call and return to Dr. Yan this morning to wrap up here on the Brush Morning Talk. We can pick up just a call, 0880-346169, 0776-360979. Other numbers to having you forming part of the Brush Morning Talk this morning. Our guest is Dr. Duba Christian. He's an infectious disease control scientist, and we've been talking lengthily on the fight against COVID-19 and the establishment of the War and Economic Crimes Code, among others. So call us on 0880-346169, 360979 added numbers. Well, Dr. Young, I guess you follow the callers this morning.
Yes, I did. One of the callers was not very audible due to the feedback, and so I was not really clear with what they said. But I think at the end, they said that the message delivered regarding the pandemic awareness was clear enough, and they would take this message back to their communities and tell other people since the message was clear. Again, I take solace from that this is what we should be doing as public health personnel, as officials of government, of the health ministry. This consistent health awareness on the issue at hand, which is this pandemic, what this virus is, what disease it causes, how can we prevent it, what can we do to prevent it, the vaccines that we have on hand, all of the questions that are surrounding the vaccines. These are the questions that I believe our authorities should be answering daily, have a daily program to be answering, so that our people will get a clear understanding. And look, if the expertise is not existing in the country, we are saying that we are available. One of the callers said they are begging me to come, to play my part in the country. And apparently they didn't hear from the earlier stages of the broadcast that we have already made this offer to come, but we are waiting for the government to play its part to facilitate us coming. So if you are still listening, I have already offered to come. Several of my other colleagues who are Liberians, professionals have already offered to come. We are a lot here, and it is only left with the government to say, yes, you people come. This is where you will be. This is what you will be doing. This is who you will be working with. This is the county you will be assigned in. All these things have to be explained before we come. So we can just get up and just come in the country. But at least I try it though. I just got up one day in April. I wrote the government 1 month ahead, and I told them I was coming. Then maybe they didn't believe it, but I came in the country still to contribute, and they didn't pay me any attention. I told them the virus was coming. They didn't pay me any attention. As soon as I left 2 weeks after, we saw what went on in the country. So on a serious note, we are willing to come in. It is left with the government to put in the necessary procedures, to adhere to the necessary procedures that will allow us professionals from the outside to come in.
Okay, Dad. So, can you just summarize all of what you said? We definitely run out of time this morning. We get approximately a few minutes to the end of the presentation this morning. Can you give us a hypnosis, just in a summary of what you said?
Well, the virus is very deadly. The coronavirus, COVID-2, is very deadly. I will ask our people to pay attention to what I'm going to say. People are dying from this virus. Nobody is dying from vaccine. It is the virus that people are dying from. We know that for sure. So continue to wear your masks. Please buy at least 2 masks, so that when you feel that you use one outside, you come back home, you can change that one and use the next one to go outside the next day. Don't go to parties. All these big parties that people go to, do not go there. Keep away from large gatherings. Keep distances from people. I know it is difficult to do when you go into our markets or when you get on a bike. But if 2 of you are masked, wearing masks, and you are on a bike, that can help. The vaccines are safe and they are effective. They are meant to help us fight the virus, this coronavirus. It is meant to prevent the coronavirus. So when the vaccines become available, please take the vaccines. Don't be afraid. Nothing will happen to you. The vaccines will help save your lives, and they will help save the lives of those around you. I want to thank you all for this program, and thank Brush FM and Sam TV and Brush TV for allowing us to do this program, for your invitation to express our knowledge and what we know to our people, so that they won't be afraid, so that they will have the necessary knowledge to go on. So I want to thank you all.
Well, thank you, Dad, and we want to in return be very appreciative as well for granting our invite to come to the platform, at least to enlighten the minds of Liberians on the fight against COVID-19 and the establishment of the War and Economic Crimes Court. I mean, it was a very splendid presentation. We are grateful, we are grateful very much for having you.
Thank you very much.
Well, that's the voice of Dr. Dugba Crazian. Of course, Dr. Dugba Crazian is an infectious disease control scientist. And of course, you hear him this morning. He has talked about lots of issues that are very key, that are paramount in the fight against COVID-19. He gave a backdrop of, COVID-19, how the virus came about, expanding to other parts of the world, how the virus came about. He talks a lot about COVID-19, its prevention and regulations that are tied as well as support-based. He talks about the politicians and their interventions, in the fight against COVID-19. And there were several other issues, including the establishment of the World Economic Crimes Code that Dr. Young talked about. He said, yes, he supposed the establishment of the War Crimes Code, the Economic Crimes Code, and that of the Academic Crimes Code as well, of which Martin K. Colley is the lead advocate for the establishment of the Academic Crimes Code as well. It has been very wisdom, and we want to say thank you so much for ending a week with us. You began the week with us, on the Breakfast Morning Magazine program since Monday, and this is the weekend edition of the presentation. We'll be back on Monday morning with a very fresh edition. Again, we want to say thank you so much to our listeners. We want to say thank you to our viewers, and let's continue to share the platform so that together, we can continue to serve you breakfast the very best. Those information that are provided, you can go about using them as your daily tool. And so that's it for this July 9, 2021 edition of the Brush Morning Talk. Join us again on Monday with a fresh edition of the presentation, at which time we are anticipating to invite lots of experts to talk about these health complications and how to go about, talking about the effect as well on the Liberian economy and the Liberian people, and those other developed nations also that have been hit by the virus. Again, we want to say thank you so much. It has been a very pleasant time together, and we wish you a very beautiful weekend. Hope that we have a brand beginning on Monday. We want to say thank you very much, and we are a team of presenters on the Brush Morning Talk. We are James Eggerson, Falkland,
and Frank Pitt Martin.
We want to say thank you so much for playing a listening role. Bye-bye, and have yourself a very good weekend.